There is a hair loss drug that is thought to increase your risk of having prostate cancer. Finasteride is a 5-alpha reductase inhibitor which also includes dutasteride, and these are drugs licensed to treat enlarged prostate. And what they do is they prevent the conversion of testosterone to dihydrotestosterone, also known as DHT. DHT is what causes your prostate to grow and your follicles to shrink in androgenetic alopecia, a hair condition that causes male and female pattern baldness. Oral finasteride at 5 mg dose is used to treat enlarged prostate, while finasteride at the 1 mg dose, also known as Propecia, is used to prevent hair loss and promote hair regrowth in men, so you have increased hair count and density. However, for dutasteride, 0.5 mg dose is for both enlarged prostate and hair loss in men, and these drugs are not licensed for hair loss in women. Dutasteride is also an off-license treatment for hair loss, unlike finasteride, which is a licensed treatment. Now, the prostate cancer prevention trial showed that finasteride reduced the overall risk of prostate cancer in men, which are the low-grade prostate cancers that are slow-growing. They are localized to the prostate gland with a very low risk of spreading. The trials also showed a high risk of high-grade prostate cancer, which are aggressive. They look very different from your normal prostate gland cells. They have a high PSA score, and they tend to grow and spread quickly to other parts of the body. However, later studies have shown that finasteride does not cause high-grade prostate cancers, and that earlier analyses were due to bias. What finasteride does is that it shrinks the prostate, making cancers more easier to detect during biopsy, and it can also give a falsely raised PSA due to the reduced PSA volume. So the bias is that you think that finasteride users have more prostate cancers, but in actual fact, you are more likely to detect prostate cancer in finasteride users than non-finasteride users due to the ability to shrink the prostate and reduce the prostate volume. So before you go on finasteride, make sure you have a conversation with your doctor so that you can be more enlightened about the benefits, the risks, and the side effects of taking finasteride. If you have a family history of prostate cancer or any other cancer, including testicular cancer, have a discussion with your doctor before buying finasteride, because as you're well aware, there are lots of companies now selling finasteride. You can buy them online without even needing a prescription. If you have any questions or comments about this video, please drop some comments below.